I am Dr. Mohammad Abubakar, Professor of Medicine, Consultant Physician, TX Hospital, Kachiguda. I am having past 25 years of internal medicine experience, and I am also having 25 years of treating diabetic patients. Patients from the age of 6 months to 100 years also I have managed diabetes. So I would like to tell you what is diabetes, how to confirm the diabetes. So you have to do one HbA1c test. Hemoglobin A1c or glycosylated hemoglobin test is very important. Anything below 6 is normal range, 6 and 6.5 it is impaired HbA1c or pre-diabetes. If it is above 6.5 or more than 6.5 it is confirmatory of diabetes. If it is more than 7 you have to initiate the treatment. If it is more than 9 you have to start with insulin, at least basal insulin. If it is going more than 10 you have to do aggressive insulin therapy in these patients. This HbA1c should be checked at least once in 3 months, if not once in 6 months, or if not first time when you are visiting the doctor, you have to get it done. We have seen number of times people just bring the report of fasting, post lunch blood sugar. They don't bother about the HbA1c because it is slightly costlier than the routine test. So they just want the treatment on that basis, and they just take one tablet and they just disappear. After 5 years they come back with so many complications. What are those complications? Hypoglycemia is also a very important complication of diabetes. When you initiate some treatment with oral hypoglycemic like sulfonylureas or glitazones or any such drugs which can cause hypoglycemia, once you start taking and once you come to know that you are diabetes, you will reduce your carbohydrate intake. You will avoid eating outside. You will avoid excess sugary items. Thereby only itself diabetes gets under control. And if you continue to take the same medication for years together, one fine day you will come back with hypoglycemia. And hospitalization due to hypoglycemia is very common in patients who are taking self-medication for diabetes. They will hear from some of the relatives. Suppose husband is taking that medication, his same medication he will give it to the wife. But the treatment for the wife is totally different, treatment for the husband is totally different. It all depends on in their A1C level, on their weight, body weight. Suppose if the body weight is, BMI is anything above 30, for them the drug of choice differs. If the BMI is below 25 or below 22, below 23, they may require the insulin, or depends on the HbA1c level also. If the A1c is more than 10, definitely they need the insulin. But they will run away from the doctor, whoever prescribes insulin, and afterward they will land up with so many complications. Hyperglycemia, it's nothing but very high blood glucose, can cause dry skin, extreme thirst, excess of urination, patient always hungry, and he keeps on eating after every 1 or 2 hours, and vision disturbance may be there, patient feels drowsy and wounds may not be healing well. So what are the long-term complications? 1 in 3 people with diabetes will develop some form of vision loss during their lifetime. People with diabetes are up to 3 times more likely to develop coronary artery disease. Silent coronary artery disease are very common. In diabetes patients, there may not be any chest pain and the patient suffers from heart attack, and there are changes after the heart attack. The LV function may come down, or there may be a sudden cardiac arrest during the heart attack due to arrhythmias and impaired perfusion. And kidney failure is very common complication of diabetes, long-term complication of diabetes. Suppose if somebody is having 10 to 15 years or 15 to 20 years of diabetes, they will silently develop the proteinuria and the kidney damage starts. Once the proteinuria starts, a maximum 5 to 10 years, they may develop the CKD. CKD is chronic kidney disease. And lower limb ischemia lower limb is lost to diabetes somewhere in the world every 30 seconds. Every 30 seconds, one amputation is done in any part of the world. So cardiovascular disease, strokes are very common in diabetic patients. Dyslipidemia or abnormal cholesterol is a part of the diabetes complication. Kidney diseases, hearing loss also can occur in diabetic patients. Neuropathy is also another complication. Patient complain of severe burning sensation in the legs or hands also sometimes, and there may be impaired wound healing due to severe neuropathy. Patient is not aware where he is walking. If he is walking with barefoot or without slippers, he will burn his feet due to the hot sun or somewhere some nail prick will be there, some problem will be there. Okay, thank you.